Yeah, so I'm Anna, I'm the Director of Public Health. Really good to see so many people on the call, and welcome today, and thanks for coming. People keep asking me what my strategy is to get the vaccination messages out to local people, and I keep saying you. So our champions basically, and our other system leaders, so our imams, our church leaders are absolutely vital to getting that out there. So we're really, really lucky today because we've got Dr. Colin Spears, who has done a lot of good work in Wakefield around all sorts of things, diabetes being a specialist area of his, and he's also the clinical lead for the COVID vaccination programme. He's come to talk to us today, which is really kind, Colin, because I know how incredibly busy GPs are and primary care are, so we really, really appreciate it. And I'll just let you say hello.
Hi everybody. So I'm not in a prison cell, the bars behind windows. I'm currently in Castleford at one of our vaccination sites.
Brilliant. So you're at a vaccination site. That makes it even more exciting. And then I just want to introduce Jo Fitzpatrick, who's our lead officer for the vaccination programme. So she's our senior responsible officer across the Wakefield patch. And that's a fairly sort of, as you can imagine, an incredibly busy role. And again, we're incredibly grateful that Jo's taken time out today to come and talk to all of us. So Jo, do you want to say hello?
Thanks, Anna. So yeah, hi, I'm Jo Fitzpatrick. Some of you might have met me. I am a pharmacist by background, and I've been working in Wakefield for 19 years, and I am I'm a Featherstone girl. I live in Wakefield as well, so hopefully know our population really well. And I'm responsible for ensuring that all of the eligible population in Wakefield can have access to the vaccine when it's their turn. And making sure that we've got all our sites operational and running well and safely.
Thanks, Jo. And then we've got Emma Smith, who works in my team, who's the Head of Health Protection. Emma, do you want to say hello?
Hi, everyone. I'm sure some people have heard from me previously. Thanks for joining us today.
And then we've got Kerry, who's already introduced herself and is also sort of a key member of the team. So I think that's all of us.
So I think we're moving over to Jo now. If you could just do a bit of an introduction to the vaccination programme, Jo, for us.
Thanks, Kerry. Yeah, so the vaccination programme started, as you will all be aware, because it is so much in the media. It's probably one of the #1 topics at the moment out there on social media and the general media as well. So the vaccine rollout is starting. It's actually started, we will say, and I'm going to give an update on where we are in Wakefield with it. But we have started with the vaccination programme in December. That's when the Pfizer vaccine that you will have all heard about got its marketing authorisation. And then on the 31st of December, that followed very quickly with the AstraZeneca Oxford vaccine gaining its authorisation as well. So we are fortunate in this country that we've got 2 vaccines to choose from to vaccinate our population. And if we just go to the next slide, please. So how the vaccination programme works, it's a national vaccination programme with a central control centre that decides, an expert panel of people that decides how the vaccine will be rolled out, and also on how much vaccine supply goes to each area of the country. So in terms of the priority cohort groups, the Joint Committee of Vaccination and Immunisation, the JCVI, that's what that stands for, they're an expert panel of people who look after vaccines and immunisations for a range of diseases, not just COVID. And so they're real experts on this, and what they've done, they've looked at evidence, they've looked at the vaccine, the properties of the vaccine, they've looked at the evidence of COVID and which parts of the population suffer worse from COVID when they get it, and they've used that to decide on how we roll out that vaccination programme, because we can't just make it available to everybody straight away. Through supply and also through capacity to be able to vaccinate everyone. So the order of priority is #1, residents in a care home for older adults and their carers. So if I just give a number there, so if you're a resident in a care home, you only need to vaccinate 20 residents in a care home to prevent 1 death from COVID. So that is the reason why care homes, and that's compared to 150 people over the age of 80 who live in their own homes. So that is the reason why, and we know that care homes have been particularly badly hit by the COVID virus in terms of worse outcomes and deaths. So very important that care homes for older adults and their carers were in that first vaccination cohort. Then it's all those over age of 80 and frontline health and social care workers, because they're the ones that are having contact with the public and also with vulnerable people. And also a workforce that needs to keep going really, and not having to self-isolate due to having COVID. And then it moves further down in terms of age range, which is all those over 75, and then to those over 70, and in with that is added clinically extremely vulnerable individuals. So that's the ones that have been asked to shield during the COVID pandemic. And then further after that, we move down to over 65s alongside those that are deemed high risk, and there's some categories that talk about that. And then we're going to over 60s, over 50s, and the eventual aim is to vaccinate everybody over the age of 18. But it is estimated that the groups above on this slide, over 50, are the ones that represent about 99% of the deaths from COVID, or preventable deaths if we vaccinated people. So if we can get everybody over the age of 50 done, we've really made a big inroad into fighting against this pandemic. So in terms of where we are at the moment, in a care home for older adults and carers in Wakefield, we anticipate, and the target that we've been set is to have everybody, every care home visited and the residents vaccinated by the end of Sunday, the 24th of January. So that's the date, and we anticipate that that will have happened in Wakefield, and it's the primary care networks, which I'll come on to in a moment, that are delivering that. In terms of all those aged over 80 and frontline health and social care workers, the target was the end of January, and we are on track for that, with a few caveats for exclusions such as the housebound, but we are catching up rapidly with that. And the reason why we're a little bit behind with the housebound is because of the vaccine. We were only given permission to move the AstraZeneca vaccine out to housebound patients last week, so that's why we're catching up with those people that can't, that aren't mobile and able to get to a vaccination centre. And then the next target is by mid-February that we'd have all our over 70s and clinically extremely vulnerable individuals vaccinated as well, and we are on track with that, and should receive the vaccine supply to do that. And then we're putting in plans after that for the other cohorts. So if we
It's me. So I think this slide is just about demonstrating that we have a long-standing history of vaccination campaigns within the UK, and vaccinations go through rigorous processes all the time in terms of safety checks, and that's both at the trial phase and sort of the manufacturing phase as well. And every vaccination batch that's produced, it always is tested before it goes into sort of the population domain and public. And I like my bake-off, so I liken it to sort of baking buns in terms of vaccine production. So we have our tried and tested recipes, we follow those recipes, we check our ingredients before we start making our vaccine, we check our oven temperature in terms of safety checks, and these checks happen for vaccination in the pathway. And then we get our buns, our 12 buns at the end of the day, and that's likening it to our batch of vaccine. And with buns, we can't resist that urge to just eat one. So we always will check that one bun batch before we share it with our friends and families. And a similar process happens with vaccine. We always check the batches that are produced before it is then delivered into the public domain. So vaccine is really got rigorous safety mechanisms around it. And this side just says as well that we've a long-standing history in the 1700s when we introduced the smallpox vaccination, and then prior to the COVID vaccine we had the HPV vaccination. So we do have a trusted history of delivering vaccination programs and the benefits that brings for us. Next slide, please. So I've briefly touched on this aspect already. So next slide, please. And I'll hand over to Colin, who's going to talk about how the vaccines themselves work.
Hi everyone. So I think it's important to think about with vaccines is that the stage we're at now is usually built upon decades of research before. There have been questions as to how the vaccines have been able to be released so quickly. It's because of that